Hey, what's going on? I'm Dr. Leila Hariri, a family and cosmetic dentist for more than 22 years. And you're listening to Ask Dr. Leila. Anything you need to know about dentistry. We're going to talk about teeth, prevention, oral health, and tons more. So relax, listen, and smile. Hello, this is Dr. Leila Hariri at the Leila Hariri Dental Clinic, and it's our very first podcast. Welcome to it. The topic is going to be veneers on this beautiful day in Dubai. People often ask me, am I a good candidate for veneers? And what are they exactly? It seems like they hear it from their friends and family members, but they really don't know what is the ins and outs of a veneer. So today I'm going to tell you from my experience. So let's go straight at it. What are veneers? Veneers are a thin layer of porcelain that is placed over your teeth. In an ideal situation, the maximum amount that I want to take away from your tooth, called a preparation, is about 1 to 2 millimeters. And that's to give me that smile that we're trying to achieve. There are some instances where we call them non-prep veneers. That's when your teeth are inwardly placed. So we actually want to do an addition. We want to add to your teeth to give us the smile. So in those instances, I don't have to touch your teeth at all. And that is a great situation to be in. But there's fewer people that actually fall under that category. But all in all, what you need to keep in mind is that the health of your teeth is my top priority. Having said this, I will lead to, generally, I ask patients if they don't like the alignment of their teeth or the color to first start with some orthodontic work, which could be Invisalign, which could be braces, whether it's they choose the metal or the porcelain, and then a bit of whitening. Usually that does the trick and people are happy with it. The instances where after you do that, the shape of your teeth still bothers you or the color is more on the gray, yellow, or brown side, then that's a situation where I say, we can definitely do veneers afterwards. And it's actually better that you went through all of that and we're doing the veneers because it means, again, your teeth are now placed in a more ideal position. Therefore, I need to cut away, prepare it less. And that's always a good thing, you guys. But if you're one of those that says, Dr. Leila, I don't want ortho, no matter what it is. I want to just do it, get it done with, and have them on in a very short period of time and get my smile, then absolutely, there's no saying no to that. As long as you're aware that we're going to be taking away, at sometimes on some teeth, quite a bit. There are two types of veneers. The porcelain, which usually needs some preparation. And then there's composite, which is done chairside, and you need a really talented dentist. The composite material is the same material that we use when we're doing fillings. So it's the tooth-colored material. But in general, when I see composite veneers and porcelain veneers, of course, the porcelain veneers are much more natural. Composite has a more dull look to it, and it's more porous, so over time it picks up stains. Versus porcelain is great for the smokers and for those people who eat and drink things that have tannine or turmeric or saffron, lots of staining involved. The only thing I've seen through years of experience that they might say, my porcelain feels it's changing color or becoming a bit more dull, it's the cement. And that we have no control over. The cement may change over several years when we bond the porcelain. But the composite changes much sooner, a few years, and the stain is within itself. You can ask your dentist to polish it up every time you come or every other time. I use my 3M discs, and that kind of just brightens everything, takes that top layer of stain away, but still, it will never look like a porcelain. But the reason we choose composite, obviously, versus porcelain would be because it's much cheaper. The cost is much less. And so it's a great reason for people to say, I'd rather start with having composites versus porcelain. Remember, this is an aesthetic procedure, so the outcome should be much more aesthetic than you start with. People often are afraid of the removal of their tooth structure, but this is only in situation where it's needed. But I reassure them that what will go in has to be much more aesthetic and functional and harmonious than what you originally start with. So it's definitely worth it, and never fear that what is going to happen if I don't like it. Because if you don't like it, I don't like it, and it will not go in your mouth. Until we both fall in love with it, those veneers are not going to be placed in your mouth. I'm going to talk a little bit about the procedure. So the first visit, you come in and we discuss what is it that you like and dislike about your teeth. Then I take molds with the alginate and we pour it up, and it's called a study model. We keep the study model, we take our photos, we do some videos, and then the study models are sent to my lab where they make a wax up on top of your existing teeth, and that's called a mock-up. They return that back to me. You come for the second visit. We place that mock-up without ever touching your teeth, and it's called the try-in appointment. So we have a look at what the lab had in mind, and then we speak, we smile. Again, we take photos, we take videos, and we look at it with full hearts to see what is it that we want changed. At that moment, we write all our changes. I send the photos, I send the videos off to my lab technician, and we ask for a second try-in. This may not always be the case. There are times where the first try-in, we're like, this is it. We don't need any further, and we can make the appointment for the veneer preparation day. But sometimes we do need a second visit, and that's okay. You come back and we put the mock-up back on the teeth with the changes we had in mind, and we see whether we are happy. And if, again, we need changes, we need to be patient. You guys, dentistry is all about patience. We send it back, they make our changes, and you come back again. Once we are happy with the mock-up, I inform you where and how much we need to remove from each teeth. So you'll be aware before your preparation day what teeth need any preparation on. Prep day, you guys, is nothing quick. I book generally half a day to a full day, depending on how many we're doing. Remember, dentistry is not meant to be rushed. And then you leave with the temporary, if needed. Remember, for those cases where it's a non-prep, of course you don't need a temporary because I haven't touched your teeth at all. Please have patience with the temporaries, as it's possible for them to come off or they can chip here and there. These are just a temporary, it's just an interim period that you'll be wearing them. As the case is, usually people need veneers because they are grinders, so they are chipping their teeth and they wear night guards. Well, during the temporary period, I don't recommend you wearing your night guard because, of course, when you come to take off your night guard, you can take off the temporary. So during the night, we don't know what's going on with our mouths. And yeah, we can wake up with, a chip here or there. But as long as you're patient, I'm always here for you guys. You can come in, I can fix it. Some people say it's not bothering me. I don't need to come in. Some others do come in and I see them, between the time that we did the preparation and the delivery day. But just, I wanted to bring that up so you guys keep that in mind. Preparation day. Preparation day, you come in and we give a bit of local anesthetic on the teeth that we're going to prepare. And we go ahead and prepare the teeth, take the impressions. I take some photos of your prep teeth and then place the temporaries and send the impression off to the lab. Depending on how busy the lab is, I say, again, you need to be a bit patient. Sometimes I get a quick turnaround. Sometimes it may take 1 week, 10 days. Maximum has been 2 weeks for your veneers to come back. Again, depends on how many teeth we're discussing. And then we book for your cementation day. Cementation day, we place them in with our try and cement. At try and cement, we have different shades. So initially when you come in, I place it on just with water or with your saliva, okay? We just place them on your teeth and we look. If we like the color, perfect. If we want it to go a bit darker, I might use a bit darker cement. If we want to go lighter, I might use a bit lighter cement. It all depends. This is patient to patient. And then we just look at it together. We sit up, we go to the window where we get natural light, and only when you and I are completely happy, we then cement them one by one. The maintenance is the most important part that I want to reach out to all of you guys. Please treat them like normal teeth. At the same time, our normal teeth are made out of enamel. And as you know, enamel is one of the hardest substances. So if we can, chip enamel, of course, porcelain can be chipped. But as long as we are aware of this and we take small bite sizes into hard foods, and just make everything into smaller pieces and avoid things that would naturally chip our own enamel, seeds, and some bad habits like biting our nails, and of course wearing the night guard. Some may say, I really don't think that I grinded, or I don't think that I'm grinding. But wearing that night guard is going to really assure the long-term longevity of your veneers. You must get your regular hygiene appointments, which is minimal every 6 months, and have your dentist look at your veneers just in case if there's anything. As always, prevention. If we catch it early, it's easily fixed. So make sure you come for your regular hygiene and dental visits. And veneers do not make you more prone to getting decay. That's a question a lot of people ask me. But like I said, you need to treat them like your own teeth. By that, I mean you need a brush and you need to floss them regularly. Actually, I need to make a point. I say this often to people. Having veneers makes your teeth stronger because it's the bond. It's bonded to your teeth rather than cemented. And that bonding really makes your teeth stronger than what you started with. So that's the big pros of having porcelain veneers, because that's bonded to your teeth. How many do I need? This really depends on how big your smile is. Usually it's between 6 or 10. And the bottom is the same story, 6 or 10. But some do only the top because that's when they smile and that's all that they show is the top teeth. Remember, the younger we are, the more we show the top teeth. And with age, as everything kind of falls down, gravity pulls everything downward, we show the bottom. So you can wait and do this in 2 steps. Or some tell me, Leila, I know that once you do the top, I'm just going to notice my bottoms more and the color will not be exactly the same. So for that reason, go ahead and let's do top and bottom. So it all depends. It's situational. It's patient to patient again, whether we just do the top or we do top and bottom. I have yet done only the bottom. That's never been the case. It's usually if we do the bottoms, we're doing the top teeth as well. How many, again, depends on your smile line. So there was a time where I think when veneers first started, people were doing the 2 fronts or maybe 4, which is the lateral to the lateral. And then they said, okay, add the canine, 6 teeth. Now we like to say 10 is the ideal, because when you smile, if the other teeth next to the veneers are a bit inwardly placed, or if we want to change the color to brighten your smile more, I feel after we give you the veneers, those back teeth become even more noticeable. But again, you can do this in 2 steps. It wouldn't be ideal because I like it when it's given to one technician and it's like an artist. So you have one person sitting down and, putting the layout. But you can do 6 at one point. And then I've had times where patients came back and did the other 2 on the right side and the other 2 on the left. So we did an additional 4 teeth, maybe a year later, 6 months later. That's possible. But the ideal, I have to say, more and more people are doing 10, and it's 10 on top, 10 on bottom, which is a total of 20. Veneers make a huge change in your smile very quickly. I always tell you guys, it makes you at least 10 years younger. And when I have you step closer to the mirror and see yourself, that's what everyone actually says. And especially other people in the family, they notice it and they say, my husband, my wife, whoever really has a more youthful look. Because with age, with the tear and wear, as we talk, we're showing more of this like a black hole, this hollowness. And the veneers put that smile line. So when you're talking, you show your teeth basically, and that's how our teeth were when they first erupted. So it's all about youth. It's an anti-aging process, as I say. It's not recommended for those that are heavy grinders or have active decay or super crowding due to needing a lot of preparation. And as well, if you have advanced gum disease, because it may make your teeth look really long, especially if you have a big smile, you can show that, the teeth are longer. So with advanced gum disease, that could be a possibility. How long do they last? Approximately, if you follow all the recommendations, we say about 10 to 15 years. They look amazing. For the shade, really, I like the natural clean look. Please do have a look at your skin tone. And I always say, I don't want people looking at your smile saying, oh, wow, you have beautiful veneers, or you have veneers? This is it's a loss to me. I want people to say you have a beautiful smile. So I want there to be harmony between your smile and your overall face. Nothing has to be jumping out. So let's all aim together for that natural, clean look. The cons to having veneers is nothing lasts forever. So 10 to 15 years, yeah, they need to be replaced, and they're usually not covered by insurance. Lastly, I want to talk to you guys about my thoughts on veneers. I want to wrap up with this, and in general, keep in mind, veneers is not for everybody. You might already have beautiful teeth, and I might tell you I cannot really do much better by placing veneers on your teeth. Please do understand this comes from experience. And if I tell you that, you might just do a bit of whitening and brighten them up, you might be very happy by doing that. Do give that a thought. I want to do veneers only when I really feel I can make a change in your smile. And that change has to be for much better. I hope this helped and this answered most of your questions on this beautiful topic. And looking forward to many more podcasts down the road.